today I'm going to be covering about the overview of inspections and audits. And before I get there, I just want to give you a quick snapshot of what the global drug development industry is up to. What's happening in the global drug development, right? So if you look at it, the global drug development industry over the last several years has been actually progressing fairly well. You know, the industry is growing significantly. Just a minute, I think there's some problem with my slides. Can you see the new slide now?
Yeah, it's moving
Yes.
now. It's moving. Yeah.
Yeah. Mm. Okay. Okay. So if you look at it, and I'm sure all of you know this, you've been in global drug development for a long time. I think the process of developing a drug is still taking the 12 to 18 years. And a lot of work is happening in terms of technology and use of new ways of working to get drugs faster to the market. Because as you know, the patents for these drugs are generally up to 20 years. So obviously companies would like to expedite the process of getting these drugs to the market. But at the same time, they have to ensure patient safety. And I will come in a while as to why patient safety is important. And some of you who are from PV would realize that. But then for the others, it's important to understand why patient safety or PV is important. So now with this, the average cost of getting a drug to the market is almost around $1 billion, And in the last 20 years, while the companies have tried hard to bring down the cost, it's not happening for the simple reason that obviously labor costs, the various aspects that you require in terms of getting the drug to the market have been increasing. So companies continue to focus on not only getting the drugs faster to the market, but also looking at better ways or more efficient ways of reducing the cost to be able to get these drugs at a better price to the market. Now, if you look at the top pharma companies, and when I talk about companies like J&J, Roche, Merck, Pfizer, and Novartis, when we look at the R&D spend, in 2026, what we expect is that their R&D spend is going to be in the range of about 15% of their annual revenue. Some of these are doing more than that. I know Roche for sure is doing more than 15%, but most of the large pharma companies are spending between 10 to 15% of their annual revenue on R&D, which is a significant amount, and shows the need why we need to have stronger PV processes as far as drug development is concerned. Now, when I look at the global CRO market, in terms of revenue in the year 2023, we are somewhere around $76.6 billion. And this is growing at a rate of about 11%. Expected that, by the end of this decade, it will be a $130 billion market, right? So that's the reason why I'm sharing this with you. There's a lot of growth that's expected in this industry. And if you look at the data, the global drug development industry is actually growing faster than the overall pharma market. And the simple reason for that is a lot of companies have now started investing in newer products, newer pipelines. I'm sure you've been reading a lot about mergers and acquisitions. So many acquisitions are happening. I was actually speaking at a conference in Boston a few weeks back, and I was amazed to realize that there are almost 500 plus biotech companies in the Boston, New York area itself. And these are like single molecule companies, people who are really passionate about, bringing new products to the market, helping patients. So a lot of these large pharma are looking at this as a pipeline. And I'm sure you also know that Basel is becoming another hub for biotech companies. So a lot of companies realize that they have to strengthen their pipelines. And in order to do that, they are looking at these biotech companies as sources for their pipelines to increase. So there's a lot of dynamics happening in the market, and that's why the market is expected to continue to grow significantly by the end of this decade, which essentially means there's a lot of opportunities for people working in the drug development industry, and then coming to areas like quality and compliance. The focus will continue to increase in this area as far as health authorities are concerned. Now, the interesting thing, and this is I think of relevance to you, the PV industry is at about $8.5 billion as of last year, right? Now with this $8.5 billion, the PV industry continues to grow at a healthy 8 to 9% growth every year, and by the end of this decade, it's going to be a $15 billion industry. Now, again, that's a significant growth from where we were, and this includes all of the PV market, including the internal as well as the outsourced market, and all the geographies, which essentially means that there is opportunities within the PV space for companies to do more and for people to get more opportunities as far as careers are concerned. If you look at the key players in the contract research organization, the reason I share this with you is because all of these people require audit, inspection support, or need people to manage their quality management system. Now, if you look at companies like Fortria, IQVIA, Parexel, Icon, Seniors Health, global companies have a significant large base in India, and they all the time need support as far as their quality management system audits and inspections are concerned. Then I'm sure you know about the IT companies who are also providing services in the PV space. Companies like Accenture, TCS, Cognizant, Wipro, HCL, they all have PV services. Again, the need for them to have strong quality management systems and inspection audit readiness. And then there are a lot of niche service players, companies which are specializing in special areas like Freer or Clarivate, Indigene. Freer, for example, is a regulatory specialist company. Clarivate is specializing on literature services. Indigene is into medical affairs. So all of these companies are required to have strong quality management systems in addition to the sponsors. And I'm not talking about the big companies which I already said. Companies like Novartis, Novo Nordisk, or AstraZeneca, GSK, now I've heard even Sanofi, BMS, all of them have their offices in India, which essentially means that they need to have the right PV professionals to have the right PV system, but at the same time also ensure that they have strong quality management systems. So the message of this slide is there is growth. There's growth happening across the world, and especially in India, because India is now realized as a hub for PV activities, considering there are so many companies there. The talent pool is good. And I was actually chatting with a few people in the UK the other day, and people actually have started realizing that the need to go to India is not just about low cost. It used to be the low cost a few years back. Now I think the need has become more talented, skilled people. And if you look at from a PV perspective, most of the PV knowledge or activity is now with people in India than with people in US and Europe, which is a good sign for us as a country where we are really developing our people to manage these scientific work. Now,